Okay, well, as I say, welcome to this first Lunch and Learn session put on by the Norfolk Green Care Network. I'm very pleased to see you all with us today. I'm sure there'll be a number of other people joining as we get going. The topic today is social prescribing and green care. We've got two presentations, one from Claire Dyke on the local scene in relation to social prescribing, and then Sam Alford on the national scene, particularly with reference to green social prescribing and where that's heading. So without further ado, over to you, Claire.
Thank you, Nigel. Are you sharing my slides or am I sharing my slides?
I think you are.
I am fine. Yeah. Bear with me. She says. It says the host has disabled participant screen sharing.
Try that. You should be able to do it, I think.
Okay. Yeah, I like that. Thank you.
Sorry about that.
It's all right. I've lost all pictures now, so can you hear and see me, Nigel?
We can hear and see you, but we can't see what you're sharing if you're trying to share anything.
Oh, it is sharing on my screen. Okay. This is a great start, isn't it?
Don't worry, we'll get there.
Let me end the slideshow. Is that better? No.
No. Can't see anything other than the participants.
Now my screen has gone completely black. Could you share it for me if you've got access to it, Nigel?
I don't have access to it, do I? Because it's
oh yeah, sorry.
PDF, yeah.
Sorry, everybody. I think we better stop the recording. Right.
It worked earlier.
No, it worked beautifully, didn't it? Let me try again. Right, there we are. Share.
Ah, that's better. We're there, I think. That's it. We're there, Claire.
Oh, apologies for that, everybody. So without further ado, my name is Claire Dyke. I'm the Integrated Care System Social Prescribing Lead for Norfolk and Waveney, and it's really great to be invited. So thank you for that, Nigel. It's always great to build these relationships and networks, especially as the social prescribing arena matures and grows. So a little bit about the system, and I don't know your target or how many of you are health professionals already working social prescribing within Norfolk and Waveney, but here's a little snapshot of just the size and scope of Norfolk and Waveney as an integrated care system. Many of you are probably aware we have over 1.1 million people now living within Norfolk and Waveney. The integrated care systems came to being in July of this year and is made up of all the partner organisations listed there, and I'm not going to read through them, but they were put in place to make sure that people can live as healthy as possible, and to make sure that people are only telling their story once between those partnerships. Now we are maturing in that area, and improvements are happening all the time. And of course, making Norfolk and Waveney the best place to work in health and in care. So my next slide is a snapshot of what the current Norfolk and Waveney picture looks like. Norfolk and Waveney has less ethnically diverse and an older population compared to the rest of England. As you can see on the middle picture there, that our population, 55% are over 75, And by 2040, they anticipate that this will increase to over 110,000 by over 110,000 just within Norfolk and Waveney alone. The partnership is based on localities, which includes the NHS, our local councils, our voluntary sector organisations, our residents and communities, and that's based around 5 localities. So Norwich, South Norfolk, North Norfolk, West Norfolk, and Great Yarmouth and Waveney, who collectively make up the integrated care system. You will see that we have jointly made some priorities for next year, for this year and next year, and I'm really pleased that personalisation is in there. But across those 4 priorities that you can see at the bottom, social prescribing sits under all of them through those place-based partnerships. So our current health inequalities in Norfolk and Waveney, I don't know if any of you have heard of the Core 20 Plus. The approach identifies the Core 20, so that's the 20% most deprived areas of our population. The plus equates to the list on the right-hand side there, and the 5 is the 5 clinical lifestyle choices that are on the left-hand side. So the lifestyle groups of Core 20 Plus make up a good proportion of why people have been referred to social prescribing, with those wider determinants being supported and often the root cause of that health lifestyle. So social prescribing improves outcomes for people by giving more choice and control of their lives. It is effective at targeting the causes of health inequalities, as described in the last slide, and is particularly useful for people who need more support with mental health. And a majority of our referrals do come through with a mental health referrer on top of those, have one or more long-term conditions, are lonely or isolated, or have complex social needs that affect their well-being. One of the key components to enabling personalised care is social prescribing. This is a form of community referral that enables frontline staff to refer a person for non-medical, non-clinical support. And it involves using the assets of our communities and those place-based approaches that I described earlier. Why is social prescribing important, and why is personalised care important? It's about a well-being conversation of what matters to the person rather than what is the matter with them. So those shared decision-making and choice conversations come into play. So when discussing social prescribing, we're looking at all age and whole population approach within Norfolk and Waveney, with the majority of referrals coming through in the adult arena. Children and young people is still developing, but there is some great work happening. So when discussing social prescribing, there are 3 main roles. So our social prescribing link worker, our health wellbeing coach, and our care coordinator, among other job roles, all of which have exceptional broad knowledge and skill in supporting the health and wider determinants of why people are being supported. And that's demonstrated in the values and ethos that you can see on the right-hand side. And I've just popped this slide in here just so you can see where the comprehensive personalised care model has come from. And this is an NHS universal model that supports population intervention that is used to support people to stay well and build on that community resilience. The 6 components are all necessary ingredients. However, key to the success, in my opinion, is the social prescribing system and the processes that will help professionals and individuals navigate the many, and there is many, as you saw in the first ICS slide, non-medical and community assets available to support personalised approaches and well-being. So through the delivery of those 6 components, personalised care throughout achieves a whole population approach to support people of all ages and their carers to manage their physical and mental and well-being, building community resilience and making informed decisions and choices when their health changes. A proactive and universal offer to support people with long-term physical and mental health conditions to build their knowledge, their skills and confidence to live well with their own health conditions. An intense and integrated approach to empowering people with more complex needs to have greater choice and control of the care they receive and where they receive it. I will send out all the links to these models if that's of interest. So what does Norfolk and Waveney look like at the moment? So social prescribing in Norfolk and Waveney delivered through the primary care networks, who build on existing primary care services and enable greater provision of proactive, personalised and coordinated and more integrated health and social care for people close to home and within their own community. So that's the place-based again. Each PCN is based on GP registered patient lists, typically serving a natural community of between 30 to 50,000 people, although there are some larger PCNs within our footprint. What's great about this is a PCN is small enough to provide the personalised care values as described, but big enough to have an impact on economies at scale. Key to all of this, and they are our bedrock, are the voluntary sector organisations as a vital partner for the health and social care sector, and they are key in delivering and supporting improving health. But I'm sure I don't need to tell any of you that. What they are fantastic at is amplifying the voice of the service user. And key to the successes of social prescribing. We couldn't do it without them. So some PCNs subcontract the social prescribing out to the voluntary sector and local authorities. So we do have a hybrid approach of social prescribing within Norfolk and Waveney. But this is good, and it has provided a good wraparound network for organisations and enabled the workforce to flourish and build those networks and relationships for the better of our communities. Just launched, and I will pop a link in for you for Nigel to share. Recently, the Integrated Care Board has worked with public health teams at Norfolk County Council to really embed and promote behaviour change approaches that support social prescribing, and it's an education tool to support the workforce to deliver making every contact count, something called MEC. And that provides support for those opportunistic delivery of consistent and concise healthy lifestyle information, and enables individuals to engage in conversations about their health. And I've just put a list there. Key to that also is the green social prescribing, and I'll describe it. I'll talk a little bit more about that later. But social prescribing is also delivered through the acute settings, right through to community and elective pathways, which is new for 2022 and will be further upscaled in 2023. So there is now a really overarching social prescribing offer within Norfolk and Waveney footprint. Now I'm hoping the next slide works. Before I press play, and Nigel, please do interject if it doesn't play in a moment, but this is just one fantastic example of a lived experience through green social prescribing, where Laura from the Restoration Trust, who you can see on your screen, really supported this gentleman, Adam, through his experience of really complex mental health, to enable him into employment within the health sector. So hopefully you can see this and hear it.
I think the hearing might be the issue, but let's see. Yeah, I can hardly hear it, Claire, if anyone else can. Is it possible to turn it up at all, Claire? Still can't hear it.
Okay.
Sorry.
I will share the video link with you all. It's a really powerful discussion that Laura and Adam have had there, and it's around Adam accessing green space, green social prescribing to really support his mental health and well-being, and the power that green space had on him as a person and his health and well-being and the outcomes of that. So I really would recommend, if I'll send the video link, as I say, and please do read that. So as well as working very closely with voluntary sector organisations, green social prescribing in the health sector is currently also providing provider-specific green social prescribing. Is quite new to the health sector, so we are developing and maturing slowly but surely. But there are PCNs completing group walks in nature through our health and wellbeing coach, through our social prescribing link workers, at individual PCNs. There are also individual practices, so an individual practice within a primary care network, utilising small parcels of green space, which are looked after by both the professional, so the social prescribing workforce that I described earlier, and the communities themselves. Often it's just a small parcel of land, raised beds where they're either growing flowers, wildflowers, vegetables, etc. But it's just a coming together to offer that space, that safe space for people to be.
Did you want to share slides again, Claire? Because we've still got the
sorry,
the video. Thanks.
Oh, that's very good. There we are.
Okay.
You may have recently seen in the news that Norfolk and Suffolk Foundation Trust have also started creating a green space in one of their secure settings, and they did that by erecting a woodland screens surrounding an enclosed space for their patients and their loved ones to use and carers to use when visiting. The ICS, as I say, is maturing in Norfolk and Waveney, and in 2023 green and blue social prescribing will continue to grow. So it'd be really good to have this lunch and learn in a year's time, Nigel, to see where we're at with that. So here I've put about so what does the impact mean for social prescribing? Data has been released from NHS England showing that 59% of GPs that think that social prescribing can and it does help reduce their workloads. Over 30% of referrals to GP practices are for non-health specific reasons, where social prescribing does play its part. So it just shows you a little screenshot of the importance of personalised care. So co-production work, I think I've mentioned this, but I've just put this here as it has just been put into the integrated care system strategy and on the importance of co-production. So just like with social prescribing, we are improving, we are growing, we want to do that together, and the voices of everyone are important. So for all the reasons demonstrated on this slide. So what are the next steps? So the next steps for us definitely the quality, helping to set and drive monitor the quality against priority outcomes for those using social prescribing services. Co-design, as mentioned in the previous slide, enabling those partnerships with a diverse range of people and organisations, allowing room for co-creation. Training, and not just training for workforce, but training for our communities and people as well. The user experience, you'll see from Adam's slide if you do manage to watch it on the user experience, just the importance of that and lessons that we learn along the way. Really excited and welcome anybody on this call to be part of a working group. And this is to develop the Norfolk and Waveney social prescribing strategy and a 5-year roadmap from 2023. And that includes the green and blue social prescribing offer. So if you would like to be part of that working group, which will be starting in end of January 2023, then please do drop me a line. As part of that working group, a task and finish group will also be created to offer a best practice framework. And we are going into new ways of working within the health sector, and social prescribing is part of those new ways of working in health. But we want to make sure it's the best offer for our people and our communities as well as our workforce. So that's it from me. Thank you, Nigel. So that's a whistle-stop tour, but I was mindful. I think I'm within time.
Fantastic, Claire. Thank you very much. There's an awful lot of material there, and we will be sharing the slides afterwards, so people can obviously look at this in a bit more detail. Just looking at the chat, see if there's any questions in there. I've got one or two of my own, but perhaps I can kick off then, and then I'll just see if anyone else wants to ask anything. You mentioned that the approach locally is a hybrid one. I think that was the phrase you used, that different organisations are providing the social prescribing linked workers and so on. Has there been any, I suppose, shared learning from those? I mean, I suppose the idea of developing good practice, hybrid is great in the sense that it enables obviously organisations to do things a bit differently, but if it's really going to be useful, I suppose, my thought is it needs to be sharing the learning, if you like, between those different approaches. Where are we with that?
Yeah, absolutely. And that's one reason that why we're building this best practice framework for social prescribing, because what does good look like? Over the last 6 months, I've been building lots of evidence of the Norfolk and Waveney footprint and what social prescribing offers. So it's about bringing that together. To develop that. Yeah, good. And just a comment really, and I'd appreciate your thoughts on this. On the green social prescribing front, as you will know, I've had the pleasure of being involved in discussions with your NHS colleagues and yourself about ways in which the NHS can use its own sites to provide, shall we say, nature connection opportunities, not just for people who are perhaps getting care on those sites or staff working there, etc., but also with a wider potential, if you like, to provide green social prescribing opportunities for wider communities. And I think it's a very positive step in that direction. And in fact, I think I was involved in a meeting a couple of weeks ago looking at new primary care hubs and ways in which the green space in those can be used really constructively and positively, and not just looking at the building sort of thing. Any thoughts on that angle in terms of developing green social prescribing, Claire? I think that will also form part of the best practice framework and our 5-year roadmap to social prescribing. And hopefully, when I won't steal Sam's thunder, but when the national toolkit arrives next year, it will really help inform how we're going to deliver green social prescribing within Norfolk and Waveney. There is some fantastic work happening, and I think we just need to ensure that it's equitable across the Norfolk and Waveney footprint in the health sectors for sure. But yeah, what is fantastic is that organisations and providers are starting to look outside of their own buildings to understand what services are required and can support their community. So as I say, definitely a growing area, and one that's happening in small pockets, but we're not quite there across the whole Norfolk and Waveney footprint, but we will be. Yeah, thank you. I see Amelia has got her hand up. Would you like to ask a question, Amelia?
Hi, Nigel. Thank you. I just had a question about the process, really, of thinking about referrals going into maybe the smaller, more grassroots community organisations. So particularly in this context, something like a community allotment or a community garden. At what point does the link worker And does it happen? Do they have a conversation with that community group just to check that they have the capacity, enough volunteers, and also they're prepared to accept somebody into their group who might have sort of additional needs? And also I just wondered whether there's any funding available for those groups if they're getting lots of referrals in order to sort of grow their sort of capacity.
Thank you, Amelia. Yeah, absolutely. The social prescribing link worker roles, health wellbeing coaches, care coordinators, community connectors, all of the job roles, yeah, they should absolutely be asking if that grassroots organisation has capacity. They do have good links within their communities, so that place. With regard to commissioning, that is something that my job role is supporting. So what we don't want is voluntary sector organisations and grassroots organisations to become overwhelmed, or likewise to have to close because they don't have enough funding, but they're actually providing a fantastic service for our communities and keeping people safe and well in their own homes and their own communities rather than in a health setting. So yeah, if organisations are struggling, then they do need to reach out to the integrated care boards, and then we can definitely have those conversations with regard to funding.
Thank you. I see Claire, you've got your hand up. Claire, got a question.
Yeah, it was along the lines of what's just been said, really. So we started an allotment project in Swaffham 12 years ago. So we've got lots of experience, lots of stories about, testimonials from people who have benefited from the project over the years. And the last sort of 3 or 4 years, we've also been a social prescribing provider with a separate project. But our biggest challenge is funding, and it's so difficult to get it. That is the biggest challenge and the biggest headache. So we now have 2 gardens, an allotment in Swaffham and a garden in Kings Lynn. And we've been funded over those 12 years from the big lottery, from the heritage lottery, from similar kind of grant funding. But trying to get any funding from health and from Norfolk County Council, or anywhere that can provide us with some ongoing funding, is the biggest challenge that we have. So it is all very well having social prescribers, because there are loads of social prescribers out there referring people to various projects, not just green projects, but without some additional funding, those projects are not going to be able to carry on, and that, I think that's where some of the money needs to be going, to be able to.
Sorry to stop you, Claire. I think you've hit on one of the key issues at national as well as local level. I noticed that Sam's put a comment in the chat about that, and I think Sam will be commenting on the need for, as she calls it, sustainable investment approaches in what she says in a minute. So unless, Claire, you want to come back more specifically on anything that Claire's asked. Sorry, Claire Dyke, as opposed to.
I mean, I was on a working group with the CCG, I would think probably 6 or 7 years ago, before, to talk about social prescribing, and even at that point, voluntary organisations were raising this question. They were saying, yeah, great, but we're going to need the money to be able to meet the demand, and that is the story, really. There are loads of social prescribers employed in different ways by different funding pots. But where are they going to? Even CAB, places like that, need the resources to be able to meet the demands, and that's the challenge.
Okay, Claire, thank you. Does Claire Dyke, do you want to come back on that at all, or shall we leave it until Sam comments?
I will put something quickly in for you, Claire. So yeah, the Integrated Care Board, so formerly the CCG, because the Clinical Commissioning Group doesn't exist anymore, does recognise that, and that is part of the formation of the integrated care system, is to enable, improve and sustainable funding for our system and across the partnership. So I think you will start to notice a change come next year with regard to that, but keep your voice coming is all I can say, and those changes they are starting to happen already. As I say, the primary care already commission out to voluntary sector organisations, but we need to keep growing that and investing in that. But I shall let Sam continue.
Thank you, Claire. Two last questions before we move on. I think one from Polly and then from Janet. Polly.
Hi, yeah, mine's just a quick one really. I mean, I work for Broadland and South Norfolk District Council in environmental strategy, and a key part of my role is looking at providing grants to communities to do environmental projects. And one of the things I'm really interested in is kind of building a legacy from those projects and thinking about kind of connecting those into what's going on in the community. So I was just, as I put a question in the chat as well, it's really about, I suppose my question is about what kind of potential support is there for really kind of micro level projects. So it might just be where we've funded some tree planting in a particular area and supporting kind of the GP practice to have the confidence to kind of see that kind of a small group within their own community as something that they might be willing to engage with, as well as something on a more organized scale that might be run via a bigger voluntary organization.
Okay, Claire. Claire, do you want to come back on that?
Sorry, I thought I've lost my mic then slightly. Can you hear me okay?
Yeah, we can. Did you want to come back? Did you hear what Polly was asking?
I got half of it. Sorry, my laptop froze.
I think it's about micro level projects and support for micro level projects where there's perhaps money going in on tree planting and hedge planting projects. Do you want to add anything, Polly, to that? Is that
I suppose it's just about, I mean, I used to work in health and social care previous to that, so I guess it's about how we might make those connections between things that are going on, funding that might be available for green projects, and I kind of make that link because I as one individual has worked across both those fields, so it's kind of obvious to me. But it seems like it would be good to have to kind of build that a little bit, to think about how, if we have a legacy from environmental projects, where's the crossover into the kind of the well-being and health side of that.
Yeah, thank you, Polly. Apologies, because I've now got poor network connection. That is an area of development, and it's something that we need to focus more on, in all honesty. As I said, I think we are maturing as an integrated care system, and the green social prescribing on its own is a whole new concept to the health world. Bringing green and blue social prescribing into that is another realm in its entirety, and we are learning as a health sector especially. So yes, we probably can support more, but we're not currently in that position.
I think if I can comment as well, I mean, Sam has put in the chat an interesting response, which I think is along the lines that we've been developing locally, which is this idea of shades of green. There are different green projects that achieve different objectives. Some are about nature recovery, some are about mitigating climate change, some are about promoting health and well-being. And there's very often a crossover between those. And it's finding ways, I think, of maximising the impact of different approaches and different ways into those issues across the different shades of green. That's something we've been starting to develop locally through the network and so on. One final question for Claire, and then I think we need to move on. Janet, I think you've got your hand up.
Yes, my question is, do you support people who are vulnerable into supported housing?
Yeah, the social prescribing link workers can do that, yeah. And they work very closely with our social care partnerships and our councils on those.
All right, thank you.
Lovely, thank you. Well, thank you for those questions, very interesting. And again, thank you very much, Claire, for that contribution, really, really helpful, and provides us with, I think, a very good foundation on which to go forward. Particularly, I think the idea of working group and developing things locally in the new year. I'm going to try and share my screen for Sam to come in, hopefully. Sam, can you see that? Is that your...
Yes, brilliant. Thank you.
Well, welcome,
So,
Sam, who's the Green Social Prescribing Programme Manager for NHS England. And well, leave it over to you. Over to you.
thank you very much, Nigel, and lovely to be here. Thank you for inviting me, and good afternoon. Just had to remember that it's the afternoon now. So if I could take the next slide, please, Nigel. So I'm not going to spend long on this because Claire's actually already set the context about what social prescribing is and whom it's suitable for and why it's helpful. But I normally start here, and the reason I start here is because it's really important that we see green social prescribing as part of wider social prescribing. So when we talk about social prescribing and green social prescribing, we look at the whole journey through, which Claire described, so the what matters to me conversation that link worker or somebody else who has got, you know, a good relationship with the person might have, and they're looking together about, you know, what support they might need, what's important to them, what they might want to do in order to address some of the challenges that they might be facing at that point in time. So we see that as the act of prescribing, if you like, and then actively connecting somebody into a community activity. So the green activity, for example, in this case, which we would see as the prescription. So I'm not going to spend any longer on that, but if I could take the next slide, please, Nigel, that would be great.
I think some people are having trouble seeing the slides.
Okay.
Is that visible to everybody?
So it should say, what is green social prescribing? Does everyone have that?
Yeah, it is now. Sorry, I think Diane made a good point of go to view options and choose Nigel's screen. So I was on Claire's, but you can choose your screen. So yeah, I'm okay now.
Thank you for that hint, Lucy. Okay, carry on.
That's great, thank you. Okay, so our programme is very much about tackling and preventing mental ill health. It's part of a national programme. I'll say a little bit more about that in a moment, but we do know that there are a range of health benefits associated with spending time in nature and actively connecting to nature. But I'll just take you through a definition that we've developed for the programme, which reflects the mental health focus. So what we're saying is green social prescribing is the practice of supporting people to engage in nature-based interventions and activities to improve their mental health. Social prescribing link workers and other trusted professionals in related roles connect people to community groups and agencies for practical and emotional support based on a what matters to you conversation. So activities are very varied. On the national programme, we have things like Walking for Health schemes that Claire mentioned, community gardening projects, lots of horticulture projects which range from kind of allotment projects that are open access right through to kind of more therapeutic sort of green care type activities suitable for people with more complex needs. Forest bathing, arts activities, you know, whole broad range basically, and the it's about that kind of connectivity and that sense of you know, engaging the senses within nature. And it does include blue and green environments, and I know you've got a lot of lovely coastlines, so it's really important for us to be able to sort of make that very explicit. And as I said, there's a wealth of evidence, and I can send you links to the evidence afterwards, but that demonstrates the benefits associated with being in the natural environment. So if I could take the next slide, please, Nigel. Okay, thank you. So as I mentioned, the Green Social Prescribing Programme that I'm working on is part of the cross-governmental Green Social Prescribing Programme. It was announced by George Eustace, who was the DEFRA minister at the time, and there was an opportunity, it was money coming down from central government, from the Treasury, and there was an opportunity for local systems to be able to apply for that funding. And the remit is really around improving mental health, and it's about working with people who've got a level of identified mental health need, but that's right across the spectrum. So working with people who maybe you know, are starting to show some of the risk factors that could be associated with a decline in mental health in the future. So maybe people who've been bereaved, are lonely, so very stressed, by their external circumstances, but before they get to the point where they have necessarily got, you know, a diagnosable mental health condition. We're also working with people who are coming into their doctor's surgery and maybe they are receiving some treatment, maybe antidepressants or maybe a talking therapies referral or something else, because they have those you know, early sort of indicators of mental ill health, you know, maybe low level depression, anxiety, things like that. And then we're also working with people who are in recovery. So people who might have been a bit more unwell, maybe they've had a spell in hospital and now they're coming home and they're just wanting to, you know, just recover and get back into their lives, and green social prescribing can have a valuable role to play there as well. Programme is very much focused on working with people who are at greatest risk of facing health inequalities. So we're working in areas of high deprivation. So, you know, that core 20+5 approach that Claire mentioned, working in areas in top 20% of areas of deprivation, working with people from ethnic minority communities, working with people who wouldn't normally perhaps use primary care services, wouldn't go into their GP sort of setting, trying to work through small voluntary groups in the community who have access to all of those different people, and very much, you know, that preventative approach. We're hoping that we will be able to demonstrate that we're reducing some of the demand in the health and social care system. That's not the primary driver. The primary driver is about increasing the access to green space for people, enabling people to get those benefits. But we do hope that we might be able to demonstrate some of those you know, demand savings as well. And obviously, we really want to understand how we can support the resilience of the green sector more effectively. And, you know, we've had some discussion and we'll have a bit more discussion about that, I'm sure. So if I could take the next slide, please, Nigel. So this is a quick project overview. We're NHS England, who I work for, responsible for the delivery work stream. So we've got 7 test and learn sites, all in communities that were adversely affected by COVID, and all in communities where there are high levels of health inequalities. So those systems are listed there. We have an evaluation work stream which DEFRA are managing, and that's like a developmental evaluation. So we're hearing about the learning that's coming through that and able to address some of that as we go. And we've just had an interim evaluation report which will be published early next year, but I can share some of the findings from that with you. And the final report will be due in June next year and published later on next year. And then just quickly also to say that we have a national research work stream that is delivered by the Department for Health and Social Care. And they're doing several things. They've just carried out a mapping activity through a survey, which some of you may have seen. So they're looking at the green provision that is available across the country, not in the test and learn sites, but more widely across England, looking at the type of need that people are working with, type of provision, some of the challenges that are facing those providers, and also looking at the green space and trying to sort of overlay the two. And that will give us really valuable insight when we think about scaling this approach further down the line. They're also running some randomized control trials, because at the moment there is evidence, general evidence, it shows the benefits of green social prescribing and nature-based activities for health, but we don't know which types of interventions are most suitable in which types of circumstances. So they're running some randomized control trials around that, which we'll report later on next year. And then the final piece of work that they've done is to look at the acceptability of green social prescribing. So they've interviewed clinicians, GPs, psychiatrists, etc., and also the general public, just to see whether people would find it acceptable if they were referred to green social prescribing services as part of their mental health support sort of plan in the future. So if I could take the next slide, please, Nigel. So we've been running, well, we're nearly at the end actually of a 2-year programme. So we've been running since April 2021. in those test and learn sites that I mentioned. The programme was a 2-year programme. It's coming into an end in the current phase at the end of March next year. And this is some of the learning really that we've gathered over that first year. And I think the bit, maybe it's buried in here, but the bit that I would have to say to you is, don't underestimate the amount of time that it takes to be able to embed this type of approach. We're looking at a whole systems approach, so therefore you need that leadership at all levels of the system, within your integrated care system that Claire was referring to, within your own organisations as well. And it is very much a collective approach. So having those partnerships across the green sector, bringing together, like I think it was Polly was saying, but bringing together sort of health and local authorities, the VCSE sector and the general public together is really important. And we've done a lot of co-design work on the national programme in order to make sure that services really are delivering what people need, and that there's that level of awareness between people referring and green services that are available. Mentioned health inequalities, building the workforce, bringing people together, increasing the understanding. Lots that I could say about that, but what's been critical for us is bringing social prescribing link workers and green providers together to discuss mental health, different levels of mental health need. What do we mean by mental health? And we have developed some kind of models around that, so that then the green sector providers shouldn't be receiving referrals that they don't feel equipped to work with, or inappropriate referrals. And also the health referrers understand who's out there and who they can refer people to. And then probably, the next thing, obviously, developing sustainable funding models, that's critically important. And what we're looking at is trying to develop some shared investment funds. And what I mean by that is bringing all partners together around the table. So the integrated care systems have got the power or the responsibility to bring all those different partners together, so the local authorities, public health, VCSE sort of sector, and to look at the opportunities to fund this. What money can we all put into the pot? What are the opportunities to commission these services like Claire was referring to? What are the opportunities for local or national businesses to contribute, to socially invest in these types of services, for example? What are the philanthropic funding opportunities? What are the relationships like with the lottery, who want to have place-based kind of relational sort of type arrangements with local communities? And then also just to think about, how do we bring money that is in the health sector and in the environmental sector more closely together? So again, I can send you some stuff after this, but we've got some great examples of where that's working really well, for example, in Greater Manchester Combined Authority. So if I could just take the next slide, please, Nigel. So, just the headlines really. The interim evaluation report is indicating that, we are managing to engage people in ethnic minority groups and people from the top 20% areas of multiple deprivation, and that there are improvements to mental health and well-being. However, I just have to put the caveat around it, and that our numbers are quite low at the moment because this information was taken quite early on in the programme. I'm confident from all of the feedback that we get that those figures will be validated and that it will grow, but obviously we're waiting to hear that at this point in time. If I could take the next slide, please. I'm just going to rattle through this, but if you want to discuss anything in more detail, that's fine. The evaluation team have put the key findings into kind of some context for us. So they're saying, to make this a success, obviously we need to be able to align it to both local and national priorities. And we've been doing a lot of work with cross-governmental partners to do that at national level. And the sites are doing that within their integrated care systems. We do need to invest significant resources to change the system. So this is about the coordination capacity to bring people together and to make change, enable people to do things differently, rather than about investment in the delivery of the activities. It is important, obviously, that everyone understands what we're talking about when we talk about green social prescribing, and I was talking about, you know, bringing referrers and providers together to do that piece of work jointly.
Yes, and that's gone through to the financial services team.
Angela,
to pay it without
could you move, please?
So that's been dealt with, Rick.
So we do appreciate and we understand, we know that VCSE sector is facing a lot of challenges at the moment. Yeah, we do understand that, and we're working together to try and sort of impact that when I talked about sort of developing sustainable investment funds for the future. Tailoring referrals, you know, we know that that is important, and you know, I've mentioned that a little bit already. If I could take the next slide, please, Nigel. You know, improving referral pathways. At the moment, we've got a variety of different approaches that we're trialing. So in some areas, we have a lead green provider that relates to the health system, and then all of the referrals come through them. And this is something that the local green network have requested. So they're kind of triaged out. And what that means is that the smaller providers that don't have the time and, you know, are not paid to be forging relationships with all of those different social prescribing teams, for example, they're still picking up some of those health referrals because it comes out through this one provider that's got a bit of resource to do that. In other areas, we've got very local teams, and the social prescribing teams are meeting on a regular basis with a small group of green providers, and they do their referrals kind of face to face and do some troubleshooting. And in other areas, we've got sort of directories that go out, and the teams, you know, the individual workers then approach the individual green providers and have those discussions about how best to make those referrals. So it's a bit mixed, but that's appropriate because we're trying to test what works well and the different circumstances in which they work. We know social prescribing is under pressure. There's a huge amount of demand for it at this point in time, and you know that has an impact on the voluntary sector as well in terms of referrals that are coming through. There's lots of challenges collecting data, which I won't rehearse in detail, but I'm sure you'll all be aware of those anyway. We do know, you know, we're starting to show that it is a really good way to engage with people who might not engage with kind of traditional health services and underserved populations. And we know, you know, finally that we need to focus in on sustainable investment. And if we get an extension, we've requested an extension to the timeframes of this programme, and that will be a very kind of clear and focused piece of work that we'll be doing next year. Nigel, if I could take the next slide, please. Okay, I'm not going to say too much about this, just to say please work with us to try and help us scale green social prescribing. And if I could take the next one, please. So this is some of the kind of the detail. We are developing a toolkit around green social prescribing. We hope to be able to get that out to you to sort of test that and see how that works and give us some feedback so that we can refine that. And we've got a product sort of at the end of the programme, but it would be great if we could do some active testing before that point in your area. And we would just really like to work with you in terms of an area that, you know, is ripe and already delivering green social prescribing. From our point of view, it'd be great to work with you and help us to scale the approach that we've already got. And if I could take the final slide, please. So the biggest ask here really is just shout about green social prescribing, champion green social prescribing, please. Green providers, you know, I'm sure you're already doing this, but really work very proactively with your integrated care system, with the partners within health that you're working with. Share your good practice, tell them about what you offer, your referral already, tell them how many places you've got. Fantastic. And then the ask back to Claire and colleagues is just making sure that it's really embedded within your local social prescribing plan. And I know that you are doing a big piece of work about that, and that it's kind of linked into all of those other priority pieces of work that you're doing. So thank you.
Fantastic. Thank you very much, Sam. Fantastic. A lot of information there. Again, I'm conscious we're running up against time, so we probably haven't got a lot of time in terms of questions, but I see there is one in the chat from Kate Price. Is there any part of the evidence base which relates to financial return on investment for green social prescribing?
Yeah, I can send you some information afterwards. We haven't pulled out we haven't got any financial return on investment from the actual national programme yet. It's a piece of work that we're doing, but there is existing evidence, and we've got some recent evidence summaries which I can share with you. Our next piece of work is we're in the middle of doing some value for money work, and there's two bits to that, looking at the value for money of the work that we're actually delivering at the moment, but also we'll do some kind of comparators, costed case study comparators really, of where people have had more traditional packages and the outcomes that they've had, and then when they've had green social prescribing packages and their outcomes.
Thank you. I've got one quick question, which, I mean, you mentioned the focus at national level has been on green social prescribing for mental health. What about physical health? Because clearly the two are often interrelated, and physical health is as important, isn't it?
Yeah, so absolutely, there is evidence about the benefits of physical health, and it's quite a nice way to engage people without having a big emphasis on getting fit, getting physically fit, etc. It's just that our programme, the remit that came down from Treasury with the money was to look at mental health, but we are, it's almost like for us, it's a byproduct. Some of the areas are looking at physical health as well, and we've got Sport England as partners, so they're obviously very keen to look at that as well.
Good.
But yeah, it's just focus.
Thank you. I see Claire has asked whether you could put your email in the chat, Sam, and she's put her hand up as well. We haven't really got time, I'm afraid, for any further questions. Did you have a question, Claire, as well as asking for the email connection?
It was just a comment really to see Sport England, I see, were involved in your project, and just to comment that we've gone to them multiple times, and they will not fund green projects unless you're going on a walk. They won't fund a horticulture project. They don't see that as exercise, but they will. If we'd added on a walking group, they'd have funded us, but that's not what we do. So
okay. Well, thank you that, and again, thank you, Sam, for your contribution. Fantastic range of information. What I was very encouraged to hear was your sort of holding the hand out to us locally and working with us to develop social prescribing generally, but obviously green social prescribing, which is fantastic to hear. It sounds next year as though next year is going to be a fantastic opportunity for us. All the work that Claire referred to earlier, but also what you're doing at national level and making the connection with that sounds like it's a fantastic opportunity. So I think what we'll have to do is perhaps between the three of us and maybe others have an after discussion about how we perhaps take those links forward, and obviously we can try and involve people in those discussions as we move ahead.
That would be brilliant. Thank you.
Thank you, and again thank you, Claire, for your contribution as well. Well, we're up at 1 o'clock, which is our scheduled finish time, so it just remains for me to say thank you very much for your contributions today, for your questions, your participation in our first Lunch and Learn session. More to follow in the new year, so keep your eye out for those. And in the meantime, have a wonderful Christmas and New Year, and we'll be in touch. Bye for now.